Good morning, everyone, and welcome to our WLA Open House. I'm getting a little choked up just seeing everybody here. It's so great to see so many familiar names and faces, and I didn't think I'd get choked up about a Zoom meeting at this point, but it's just great to see you all. My name is Emily Keller. I'm the WLA Board President for 2020, and I'm a librarian at the University of Washington Libraries. Danielle, would you like to introduce yourself?
Sure. I'm Danielle Miller, and I'm the director at the Washington Talking Book and Braille Library, and I'm the WLA Board Vice President. And I'm really glad to see so many people here. This is really exciting. And if there's anyone watching on the YouTube, good morning there as well.
So just a couple of notes as we get started. Danielle and I had an intention for today to really just offer up a space to allow everybody to share what's going on in their libraries, kind of what's top of mind right now. How are you thinking about things going forward? This is intended to be very informal and participatory. We've got a big group here, but I think we're going to be able to manage to just facilitate a discussion so that folks can share. I think WLA is a community, and this is a great time to bring that community together so that we can listen to each other and learn from each other and support each other right now. We're all over the state. We're in different types of libraries. We serve very different roles in our libraries, but this is a time where we just thought WLA would be an excellent space to open up for sharing. Danielle, do you want to make a couple of notes about how we'll proceed today?
Sure. So we really want people to share and talk. There are a lot of people on here, so we're just going to have to try and watch our manners and not step on each other's toes. So stay muted, but go ahead and we're going to have some prompts as we go through. Emily and I are going to take turns sort of asking a question or giving a prompt for the conversation. We want to take time to let people participate and share their thoughts on each of those. So just unmute yourself and participate, and we'll try and give everybody a chance. You can also enter your thoughts in the chat, so be watching there, and if there's something we feel like we need to highlight, we'll try and bring that into the conversation. Definitely feel like turn your camera on if you can. As they mentioned in the chat, we love to see that. And this is being recorded, so if that makes a difference to you in whether you want to share out loud or not, be aware of that. And we just really encourage you to participate.
So let's just get this conversation started. What is your experience right now? What's top of mind right now, which might be different from yesterday or the day before?
Do you want people to just jump in? Okay, my name's Sue Shipman. I'm the Access Services Manager for the WSU Libraries. And we just partnered with Haughty Trust to make use of their emergency temporary access service. And so they excuse me, they have digitized monographs, and the monographs that we hold in paper that overlap with what they hold digitally now show up in our catalog as digital only, and we can't loan the paper copies, which is terribly interesting. It has to do with copyright. So for us, the main thing is getting our patrons the material they need as soon as they need it. And that's that.
Thank you. And I want to just note, I saw a comment in the chat that someone mentioned that reentry is really top of mind, and we do have a question about that. So I think that's probably really on everybody's minds. So we'll get to that topic, and if people want to share their thoughts on that. What are other people thinking about right at the top of their minds right now? I know there are 100 people here. Got to be some other thoughts.
Hi, my name is Johanna Jacobsen. I'm a librarian at UW-Tacoma, and connecting with students, which is the highlight of my job, is pretty challenging these days. We have Zoom consultations available for bookings, excuse me, but it's hard to connect with students in a meaningful way. And we're seeing that reflected in student surveys as they're coming out. So to distill that broadly across library types, how do we connect with patrons at a time when we are remote?
Other thoughts on that, on services that you've moved online?
Well, I wanted to mention, this is Katie Hart from Centralia College. One of the struggles kind of related to online services is, you know, I'm at a college, former community college, and we have a lot of students who don't have high digital literacy. And how do I offer them supports through a digital and online mode when their digital literacy skills make that a barrier?
Oh, Katie, you froze up a little bit there.
Oh, what part did I freeze that?
There was the barrier, and then it kind of froze.
Oh, I think I might have been done.
Okay.
I just awkwardly stopped.
Okay. Yeah, I think that's one of the things we want to talk about too. What are the equity issues that people are picking up on, the digital divide, and you know, impacts on specific populations that people are seeing.
This is Carolyn Logue, your lobbyist. Can you guys hear me? I'm not sure about my connection. I think the other thing that needs to be talked about is there will be a plan for reentry and reopening. And one of the things that you guys as libraries need to be doing is getting together, probably in your divisions. School libraries will be different, and the university library, the academic libraries. But for the public libraries in particular, maybe looking at the library size and coming up with a plan. You know, the governor doesn't want to pull the Band-Aid off real fast. So, you know, discussions of how could a library, public library, reopen, under what guidelines and conditions could that occur? I think thinking about that now, rather than waiting till, you know, mid-May or the end of May, I think having that plan ready so people know what to do. That way you can get PPE for staff lined up if you need to. If you want to have it's very possible you might have to kind of do what retail stores are probably going to have to do, and what some are doing now, where you have certain numbers of people allowed in, you know, based on square footage, ability to social distance. Take a look around your libraries and how could you spread people apart more. You know, probably you're going to have your staff masked up when things first start. So how do you get access to that personal protection equipment? And really kind of using this forum and the library association to drive that, because don't wait for the government to tell you how that's going to be done, because they don't know how the libraries work, and you're going to have it. You have large libraries, you have small libraries. Some may be able to control how many people come in easier than others. And so having those discussions, those guidelines, and those plans being happening now, and kind of thinking how to do that will be very helpful to the governor, actually. And it's something, it'd be great if we could say, this is how we could foresee libraries starting to reopen for in-person services.
Mm-hmm. Thank you for that, Carolyn. I think that's really important that, you know, we know our users and our facilities and our staffing and what those challenges are going to be, and we want to be driving that bus. I saw a report that came out from, I think it was the Johns Hopkins Center for Health Security that was suggesting that libraries are low-risk environments, and that report was sort of suggesting that libraries are kind of these quiet little places with not lots of people trafficking in and out, and they had to retract that because they didn't understand kind of a contemporary what contemporary libraries are. So I think that's really important. What are some of the plans and thinking that folks are pulling together kind of for what reentry might look like? How are you talking about staffing, space, and all of these issues?
This is Alexa from Whatcom County Library System. I'm sorry I don't have my video on. You're nodding, so it sounds like you can hear me. We're talking about removing a lot of the furniture in our branches. So like I operate in a small rural branch, and we've got a couch in the kids area that's not easily sanitized. So we're talking about, removing things like that, which will, not give people a place to hang out at, which is sad, but also part of the idea, and that we kind of want people to come in and go again, so that we can bring more people in, because we are talking about limits on patronage in the library. One of my concerns about that is equity, like was mentioned. We're talking about, because we'll be reducing some of the number of our computers to maintain that 6-foot distance. We're also talking about something we haven't done before, which is a computer reservation system. But for example, a lot of my patrons, they don't have internet at home. It's really difficult to get a message to them about how we're doing that. So say they're a high-risk person, they come and use the computer, it's all booked up, and they've made this trip into a public space for nothing. And then how do I guarantee they're going to be able to get that computer space when they need it? So just some of those, so there's some of the things we're talking about, some of the things we're trying to work out. We're still in the beginning stages of planning.
If we could get some of that in writing, particularly, I'll tell you right now, the construction didn't reopen because the governor said, this is how it's going to be done. He reviewed what industry experts gave to him, didn't take it all, but all of those ideas are what he could put out as guidelines to say, this is how libraries reopen, under these things, and you guys get to write it. And they take a look at it and say, yeah, that looks like it's safe, and they run it by the health experts.
There were a couple good comments in here. Someone mentioned the problems with elevators and study rooms. And I know we have a very small children's room, so that's something I think about. And Elizabeth Wakia asks about if anyone is working with their county health department to do building assessments or L&I. Someone, and Charlie Eaton mentions they'll be eliminating short-term loans to reduce contact with items. So those are a couple good comments. If anyone else has things to add that they're working on with their reentry plan.
I'll also add, this is Alexa again. We are talking about one of the very first things we'll probably bring back is a curbside pickup before we even open our buildings.
How about staffing? We're hearing a little bit about space. How are you thinking about phasing back in staff?
Well, this is Michelle Drovedal with the King County Library. I'm a regional manager of, and I have 8 libraries from very large and busy to very small. We have just prepared a draft that we're going through with phased opening. First, probably no public, but staff to get into the buildings. Everything is on the table. We're talking about cleaning materials, how we're cleaning the buildings, which have already been cleaned. And we've been working closely with other library systems like Seattle Public and Tacoma and Pierce. So we want to have kind of, because we're, and Snow Isle, don't want to forget Snow Isle. We want to work together with public libraries. So there's kind of a standard. There's going to be variations, but we want it because when something happens in Seattle, people call King County and say, how come you're doing this? Or, and vice versa. So we're working together with all the libraries that touch us and maybe a few that don't. and we have a re-entry team, we're calling it, that are trying to look at every single little thing, and things like how we're going to keep the place clean, how we're going to bring books in, how we're going to check out. But the first part is we're going to have a staff only in the building first to kind of get organized. And well, I'll just stop right there because I go on and on.
Thank you, Michelle. I think that's an important point about coordinating with other stakeholders and folks you have cooperative relationships with. Who else are folks coordinating with? As somebody mentioned in the chat, the health department, other actors that you're interacting with that other folks might need to be thinking about.
Hi, my name is Malia Tui. I will put the video on. The hat being because it's a bad hair day, so that's why I didn't want to go on camera. I'm from Pierce County Library. I'm a supervising associate there, and we're doing pretty much the same thing as King County had mentioned. We are slowly going to let staff in, make sure we have the PPE lined up before we do that. And we were talking about staggering staff. Like so many work one day and then the next group of staff come in the next day to keep the social distancing and curbside service as well. Our Georgia, our director, is working with the Tacoma and Pierce County Health Department and our facilities department. So we are working with other organizations in looking at how we can do this right and for the safety of our public as staff as well. I'm going off camera now.
Thank you, and thank you for mentioning PPE. Carolyn's noting that this could really be an issue. How have folks been looking into that so far? What you're going to require, what materials you might need?
Hi, this is Beth St. George at the Lopez Island Library, and we're a small community, but we certainly have the same issues. But we also are a very supportive community, so we have a group that's been making cloth masks for almost everyone on the island. So you might look into, some type of group that could do that for you if you're looking for masks.
I'm a teacher, so I can wait folks out until people chime in. I just want to make sure that there's space here. So please jump in.
Hi, I'm from Fort Vancouver Regional Libraries in the Southwest Washington area, Clark, Klickitat, and Skamania counties. We have been testing out some virtual programming online using Zoom, Google Hangouts, and some other platforms. We've been doing Dungeons and Dragons groups, our conversation circles for English as a second language, Spanish conversation circles. We've also been doing some read to the dog programs on Facebook pages. Basically, they video the dog and the kids can, sit near a computer and read to the dog that way. And then we've also had them, they've done some books, where we've had permissions and so forth, some reading of books with the dog that the kids can watch. And so we haven't gone public with it. We've been using participants that were already in our programs while we get all the kinks worked out. And then we're going to open that up pretty soon here, probably within the next couple weeks, more for the public to new participants to join in and so forth, and start promoting them more. And then another thing we're preparing for is the curbside assistance, as someone mentioned. And then we're also, preparing for the phase after curbside, where we're going to have to space out furniture and have sneeze guards in, PPE, all those things that have already been mentioned. So. And I see someone asked in the comments there, how is the D&D organized? So we've had to combine where, normally we had programs at different branches. We're combining branches because location isn't an issue now. So we have some staff that are coordinating. We've used actually a couple different platforms. And I can email you or connect you to the staff that is doing that if anybody wants to email me. My email is volunteer@fvrl.org, and I'll put that in the chat. But we are using a couple different platforms for the D&D where people can join in and play the game. And they've come out without taking a lot of time, there's a lot of creative ways they've made it work. But I'm happy to share more about that if somebody wants to email me, and I'll put my email in the chat.
I love that with the dogs. One of the things that's great about all these Zoom meetings is seeing so many people's pets. I wonder if you could answer, or someone else could. It was quite a while back in the chat, and I'm sorry we didn't address it, but somebody had asked if someone could explain or what was meant by curbside pickup. There was a question about that. So maybe you or someone else could come on and describe how that works a little bit more.
Sure. So we're still working through this, and we have about 10 different committees, and I'm not participating in that particular committee, so I don't have all the finite details. But basically, we're looking at like Kaiser, how they are giving out prescriptions, how stores are doing grocery pickups and things like that. So something maybe, we haven't this is not set in stone yet, but something where people would pull parking spaces and, we'd say, parking space 1 is waiting for, Jane Jones books on hold. And so someone gets them and brings them out to parking space 1. It's definitely exploring a lot of community delivery services to see how they're doing it, to try to get the best practices. One thing that will be overwhelming at first is we've had our book drops locked, and on the last day that we were open, they wiped out our shelves, much like toilet paper at the grocery stores. And so we're going to have thousands and thousands of returns all at once. And then, we have to kind of quarantine those books most likely. And then the other thing is we have thousands and thousands of holds that have happened while we've been closed that we're going to have to pull those books. And, so there's a lot of those pieces that have to be worked out along with that. The other thing we're considering is books by mail. We used to do that years ago very heavily before we built larger branches. And, but we're looking at returning to that model and sending books out and exploring the cost, at least to mail books, and then people could return them in the book drops. That's one thing that we're leaning towards. But again, we're working through all of that. There's still a lot of details to be considered. And there may be other FVRL people on here that could chime in and share a little more. But I will put my email, and I can connect people to others if they have further questions.
Guys, I also can send you links. One of the things that some retail stores are doing, if this would work, is putting portable hand washing stations at their doors to encourage people to wash their hands before they come in, and give them a chance to also wash their hands when they come out. So not just the PPE, but the access to something like that. I'll send some links for that, but also trying to find hand sanitizer as well in your community to have available. For both you guys and also that increases the comfort level of your patrons when they're in there.
So the curbside pickup is kind of our earlier phase, maybe before we're opening our buildings. And then another issue that you mentioned there, Sherry, was the issue of maybe needing to quarantine the books or find some way to sanitize them. How are folks looking at that issue?
There was just an IMLS meeting for libraries that included folks from the CDC, and I think that 24-hour recommendation came out of there, and it was very recently. Did anyone who's here today attend that webinar? Susan, would you be willing to tell us about it?
I think part of what they said, I took some notes. Part of what they said was that the chances of you getting COVID from a book are fairly low, because you'd have to touch a place where somebody actually sneezed or coughed on the material and then touch your face. So you always want to be careful when handling them. But they said that, 24 hours is plenty. And if you're really worried about it, 48, but it doesn't have to be beyond that. Because once the virus gets into the material, it's hard to get it back out. I mean, you'd have to be flapping the things around, and so you just want to be careful. But they have really good, you should try to find that link to the to that webinar and watch it. It was really good.
I just put the link in the chat.
Yeah, no, they talked about disinfecting. You can disinfect the plastic surfaces like your CDs and your DVDs, but that you don't need to do that to cloth and paper bound material, including cardboard. But it's very good, and it was very edifying. Made you feel better. Made me feel better about groceries.
That's great, Susan. Thank you. This reminds me that there's some evidence base for us to make these decisions, and that we're not all going to have to recreate the wheel here. But as you're speaking, I'm thinking about how we're also going to need to communicate to our communities what we are doing to protect them, to protect the to protect staff, and that our communication planning is going to, it's already ramped up, but how are we going to do that communication planning going forward? I think Karen mentioned earlier that part of what they're doing to reach out is actually calling folks who are over 60 to check in on them and see if there's anything that they can do to provide any kind of information services. So that's one way that we're both reaching out and communicating, but around these issues of kind of what we're doing in our libraries to protect folks, I think that's going to be important. Has anybody been thinking about communication planning, or folks have any insights to offer there?
This is Beth Halstein. I'm not answering that question. I wanted to go back to the CDC recommendations on materials handling. I watched that webinar with a number of my colleagues, and we were not impressed. We felt like those people had no idea what goes on in libraries, and they felt like you sat at your clean desk with a book and you turned the pages and then you brought it back. They've never seen what we see being returned as bookmarks, the nasty, gritty, gooey stuff. And I think 72 hours or more is going to make more sense for our public libraries.
We actually had a book returned once where the patron didn't approve of what was in it, so he spit on it and then turned it in. It was nice. Not now, not during COVID, but it was still disgusting.
We're doing 48-hour, or I mean 4 days, just to be safe when we quarantine our materials.
This is Danielle. At the Talking Book and Braille Library, most of our materials are in plastic cases, so the surface is a little bit different. And before we were sent home, we were doing 8 days because there wasn't as much information. I think what we would be doing would be the 72-hour with the hard surface. So it's different with different materials, and I think being safe is, it's hard to say. There's so much information out there, and I think you never know what people are doing with materials, and then our materials go by mail too. So we have that uncertainty of, we can say we handled it really well, or we quarantined it, or we disinfected our machines that we loan out, but then it's still going to go through the mail to get to our patrons. Should we had another question for you to consider about what kind of strategies are you coming up with for changing how we provide services? Things that you're doing now or things that you're considering as we move forward. I think it's come up several times in the chat about the summer reading program. I know that's going to have some implications for changing services.
Hi, this is Scott with Jefferson County Library, and we spent the last couple of weeks looking at online trackers so that we could have that distance engagement with our library system. But as part of that equity, we're also talking about doing weekly postcards out to people so that they can participate even if they don't have that digital connection. So just providing some different alternatives to what we usually have in-house.
Scott, can you elucidate a little bit more about your weekly postcards? What do you include in those?
Yeah, it's still something we're developing. So the idea is we'll have some challenges. We were going to have them on the back of the tracker, like build a fort and read in that fort. But now we can put that on a postcard and have everyone, encourage them to build something at home with blankets or cardboard and have an activity and then do some reading with it. And we're also looking at doing a weekly check-in at the end of the week, so people, if they do have that digital access, can show what they made or talk about some of the experience they had.
Yeah, one of the things our children's librarian had talked about doing was story walks, and basically having the various pages of a book along certain parts of the community where our patrons often walk, so that they are reading the book as they're out walking. We've done a scavenger hunt where you take photos of various things in the community and post those to our Facebook account. So we're counting those as engagements, and we're counting that as a program, and have stats for that. So we're finding ways to get people out of their homes and do things in the community, but still then send it into us as a way of engaging everyone. So.
Thanks for that, Ryan. I really appreciate these really creative approaches to doing things differently. But you also raise another important point, which is assessment. How are we tracking this? We're really going, I mean, this might sound crass, but we can't waste this moment to show our communities what we've done to support them, so that when we're talking with funders and stakeholders, this is an important moment for us to be gathering these stories for our advocacy efforts going forward. Budgets are not going to be pretty, so whatever stories we can tell about what we've done to support our communities and what we're going to need to do in the future, I think is important.
I will say, just to kind of piggyback and add to that, anything we've posted, even if it's coloring sheets, anything that really is just things to get materials out to them. It always comes with the encouragement that when you do it, take a photo and send it back to us. Again, there's something tangible that we can count with that, rather than just saying, we've posted this on our website. We can say that, you know, we had 50 kids color this and send in, you know, their contributions. So it is important to have something, you know, tangible that we can count, for better or worse. So.
And Ryan, you mentioned earlier that you're calling folks who don't have an email listed in their account.
Yeah, so we found, despite the fact that, you know, you can publicize stuff on your website, you can post on your Facebook, you can have articles in the newspaper, but you will still have, you know, 75 voicemails when you go into your building of people going, I'm worried about this book that's checked out. Can I renew it? Blah, blah. And it's like, we've covered all this, but they didn't get the memo, however, for whatever reason. So we sent out emails to everyone that had an item checked out, informing them of where that stood. And then for everyone that had an item out that didn't have an email in their account, we called them, made sure they understood exactly what the situation was. And then we've been just kind of randomly calling people each week, just kind of checking in and seeing how they're doing, making sure that they know we're still there. And so it's, and I will say you get more appreciation from those phone calls than you could believe. So it's just a matter of trying to stay connected at this point.
Yeah, Lorana's pointing to an important issue around PPE, and libraries are not going to want to be fighting with other library systems to try to pull this together. So I think Carolyn's point earlier about articulating what we need and making those appeals to the folks who can help us with that is going to be really important. I'm a little afraid to go down this road, but I think it's something we're all, it's in there if we're not directly confronting it yet. Maybe it's a little too far in the future, but what are folks hearing about budgets and funding at this point?
I'm on the Washington Digital Library Consortium's Advisory Committee. So for those of you who are part of the Washington Anytime Library, we're looking at budget really closely for overdrive, and stats are soaring, as you may imagine, and looking at whether libraries will be shifting money to support more digital resources, if they're going to continue buying books in this time. It's a great question.
At Scott with Jefferson County Library, we did have a conversation about some of the digital items and looked at about 1/4 of our monthly spending for books and have shifted that to digital content. So there has been some of that adjustment with budget for us. But I think because we're in an unincorporated area, we don't have the same governmental infrastructure that affects some of the other spending concerns.
And as Greg is noting, some of these budget considerations could be pretty indirect. If enrollment goes down, then the whole organization is looking at a different budget context. Yeah, furloughs, no cost of living increases. probably some hiring freezes. So there'll be a lot of creative thinking around staffing in the future as well.
I think there have definitely been unexpected expenditures, like all the disinfecting wipes, the hand sanitizer, the gloves, the masks, laptops, and VPNs for staff to be able to work remotely. Those are unexpected costs, I think, that hit the budget. And if you already had a pretty tight budget, those were things that you hadn't planned for and that we're probably going to have to keep funding for the foreseeable future. So that has an impact as well.
Yeah, Kate brings up an important issue about rural and small libraries and kind of what those contexts are looking like. Being in a larger city myself, I have not, it's only anecdotal that I've heard about how smaller libraries are supporting their communities. Does anybody want to chime in there? I think, a lot of folks are working in smaller settings, maybe solo staffing. Does anyone want to chime in about what things look like in your corner of the state? Yeah, Lorana's bringing up that important issue about screening, and I think a couple of folks have mentioned earlier, are we going to take temperatures? We don't really have a good sense that there's widespread testing happening statewide. How are folks thinking about that in any of our planning going forward for reopening? Has anybody heard any discussions about that?
Yeah, I saw Claire unmuted and talking, but we weren't hearing her. So Claire, I just want to let you know, I see you're having that trouble. I'll private chat with you.
I think can you hear me now? So it was actually a responding to a question before the last one you said, Emily. And it was the question that you directed at the smaller and rural libraries about possible furloughs and layoffs. And I was just thinking that I work at a community college. As people start coming back and the economy is still bad, we traditionally get more students. But I also think that it's going to be a time where we experience financial difficulty, and the administration will look to the library for layoffs just from past experience. And it would be a really great thing for WLA to do some sort of value of the libraries in economic difficulties, even if we have to do social distancing, even if we are not quite all in buildings yet.
Thank you for that, Claire. I think you're right, and I think those are going to be cases that we're all going to need to be making in our own communities. But we can pull together and see if we can support each other in doing some of that. Is there, could there be some kind of campaign where we might be able to not have everybody have to recreate the wheel entirely and maybe customize something? Maybe I've seen a couple of pieces out from the Libraries Transform campaign that have been more tailored to the current situation. So maybe there are some pieces like that ALA is pulling together as well. So beyond the state, what resources do we have for advocacy? Yeah, thank you, Sarah. That's a great idea, is sharing some of this through the state library social media accounts so that we know folks across the state are able to kind of see all of these creative and innovative ways of addressing these issues, and seeing if there are ways that folks might adopt or adapt those practices in their own libraries. Thank you, Angelo. I think it's important to talk about kind of folks who are homeless or other disadvantaged populations. What else are you seeing in terms of kind of the equity impacts?
I know I am breaking the facilitator rule here by jumping in, but I think the blind and disabled community, by not being able to get their Braille and audiobooks by mail, those who aren't able to access the internet and do the downloading books, they're really taking a hit right now. They're really hurting by not being able to get those materials. So I think that's a pretty big deficit. Yeah, Carolyn, do you want to say a little bit more about that, if you're on, about L&I's requirements?
So this is what they're doing for the current open essential businesses. And if you've gone to a grocery store lately, you've started to see this. Their L&I is saying you should be screening employees and customers and that type of thing. So you'll see it in addition to limiting. So you might see a sign. Somebody said something about allergies. The thing is what they ask is, are these symptoms unusual for you? So yeah, I've got allergies. It kind of goes along with wearing the mask if you're sneezing and coughing at all, but you know that that's normal for you. So what they're trying to get to is those people who are actually ill, different, something's different. It's not perfect, but that's how they're doing the reopening for construction right now, is the employers are supposed to screen their employees. And a lot of the essential businesses that have stayed open, they screen their customers. Like if they're going in to do a service in somebody's house, they'll say, has anyone been sick in the last 2 weeks with a cough, a fever, list the symptoms. And once again, that is unusual. That is different. That is clearly not associated with a seasonal allergy. So those are the kind of questions that are being asked. And that's the thing, is the more you guys do and put together your things, you can say, this is how we could do this. But there's going to be some labor and industries safety for workers, stuff that is going to overlay this as well. For your employees, it's easy. For your patrons, it might get a little more difficult. And it's just a trust thing, because you're not going to be taking everybody's temperature when they walk in the door. It just probably is not going to be realistic. And testing will not be widespread for some time. And there's not going to be a vaccine, for some time, because they've got to make sure it works and it's safe. So it's going to be a lot of trust, a lot of hoping people wear their masks and wash their hands. Those are the two big things.
This is Lisa Gresham from Whatcom County Library System. Thanks for that clarification. Our health department did talk about having like a 5-point survey that we ask staff to ask themselves every day before they show up to work, and it includes those things. Do you have a fever? Do you have a cough that's unusual? et cetera. Do you have a sore throat that's not related to something else? And we're considering asking staff to report to their supervisor an hour prior, at least initially, an hour prior to work every day, just whether they passed or failed that test. They don't have to provide details, but if they failed, then they'll need to either go get a test to show that they can come back to work, or I think the current standards are stay home for 3 days with a sore throat, or 3 days after the sore throat and a week for the fever or something. So it would be a requirement that staff are out of work for a while. We still have to work out the details of that, but it sounds similar to what you're talking about. And then we thought we would post that on all of our entrances, both staff entrances, reminding staff to ask themselves those questions before they enter the building, and as a suggestion for patrons that they should do the same.
Thank you for that, Lisa. It almost sounds like, you know, the kind of explicit norms that we're all probably going to need to get used to, and that actually just asking ourselves those questions daily and communicating with our employers around those would be really useful. I know this is a dark, difficult panoply of subjects, and I don't want to create the impression that I'm asking folks to perform positivity here, but I'm also wondering just what are you grateful for? I mean, I feel like this is putting a lot of things about our systems and our work lives and the challenges that our users face kind of in relief, and that a period like that can also just raise awareness about what we might be grateful for, in addition to kind of what all the hardships are. What are you grateful for? Are there any silver linings here?
I'd like to jump in if you can hear me. My name is Mary Anderson. I'm with the Central Skagit Cedar Woolley Library, and I'm just a lowly library clerk. But I have to sing the praises of my boss, who has already put together a several-point plan for reopening with different phases, whether it's not open at all, open a little bit, open more and more, and she's already addressed many of these issues. One thing that about the curbside returns is that we're going to have boxes outside. People will put their returns in. We will retrieve the boxes and then bring them inside, label and close them so that we know when they were returned, and then we will wait the appropriate number of days before we open them and check them in. We already have one staff member a day going in every single day of the week. We're a small library, and they check the drops, which are closed, but they do check them, and they do a check of the building. We have one person designated who goes out and retrieves all of the books on hold. Right now we have 90 books at the front counter waiting to be checked in. We will not check them in until we're open, and we're planning on doing book grab bags for people, especially our patrons who are older or do not have internet access. Those people will either be able to call in and say, well, I like this author, or we could look it up on their account and put together a grab bag of mysteries, cookbooks, magazines, whatever that particular patron likes to do, and then we will have that ready for them when we do partial reopening. And we've already distanced many of our furniture has been removed. We're planning on putting 6-foot intervals on the carpet so that people will know to stand 6 feet away. We will have someone positioned at the open door when we do open the building to the public, and we will allow only a certain number of people in at that time. I'm so impressed with my library director. I just have to shout out for that, and I'm really grateful because we are all at home working, except those who go in once a week. And what we do at home is we are, all of us are familiarizing ourselves with what's going on with the unemployment, so that when people come in and are needy and desperate, we can help them immediately and know exactly what they need and tell them what they need before they come in, so that we're familiarizing ourselves with a lot of these things. So I just wanted to say thank you. There were a lot of great ideas here today, which I will pass on to my boss if she's not listening. And I just wanted to say thank you for having this wonderful opportunity to get together via Zoom. Thank you.
Thank you, Mary. Thank you for all those thoughts. I'm seeing a lot of appreciation for leadership and management. Scott, you mentioned proactive leadership. Can you say a little bit more about that? And of course, kitties. Kitties are helping a lot these days too.
Yeah, so we had our library closed to the public for a week. Well, there was the initial, and our leadership was paying more attention to what was going on. So, but just having them take that week where we were still in the library, we were doing curbside pickup and had this transition period where everyone was getting laptops to work from home and training on like our phone call service and the Zoom platform. And then we have daily check-ins, which we used to do at the library, and now we do them via Zoom every morning and can see each other and talk to each other and get updated about things. And our director, Tamara Meredith, has been drafting a plan for reopening, so we have a 4-stage plan and are able to anticipate what we'll be doing and how we'll be interacting with each other and our service population, depending on how things unfold. So it's nice having that support for flexibility, but also an opportunity to kind of look ahead and anticipate how we'll be adjusting.
I'm appreciating all the appreciations here. Grateful for the union. This is an important moment to acknowledge and value our workers. Some of the things that folks are doing for self-care, just in terms of being grateful for their families, their pets. We have a lot on view right now that are just awesome, so thank you. From YouTube, more gratitude coming across there. Yeah, again, I don't want to sound Pollyanna, but I do think that in the middle of this, it's good to reflect on our values, the hard work, the support that we can provide to each other. I think we're going to wrap up. I really appreciate the time that you've taken to share your thinking today. WLA has put together a resource list around COVID-19, and I think we have some great new resources that might not already be there, and we're going to be in more communication with Carolyn Logue, our lobbyist, and Kristen Pifo, who runs our advocacy committee, just to make sure that we're gathering the resources that folks need right now. So expect to hear from us in the future around all of this, and please don't hesitate to reach out to WLA. Info@WLA.org is your best friend even when you're not quite sure what kind of who to direct your question to. You know, we have a fantastic network of folks around the state here, and if you're struggling with something or would like to share something, this network is here right now for just this kind of thing. So thank you all so much for joining us. Hang in there, take care of yourselves and each other, get a little sun, a little walk, lots of water and deep breathing, hugs from those you have nearby. And thank you to Danielle and to WLA for pulling this all together. I appreciate it.
Thank you, everyone. Bye.
Take care. Bye-bye.